Right now, millions of American families are facing the possibility of losing their ability to put food on the table. The House of Representatives has passed what experts are calling the largest cut to food assistance in U.S. history. We're talking about nearly $300 billion being slashed from SNAP, the Supplemental Nutrition Assistance Program, over the next decade. This isn't just about numbers on a budget spreadsheet. This is about real families, real children, and real communities that depend on this vital safety net. Today, we're going to break down exactly what's happening, who gets hurt, and why this matters to every American. Let me start with the big picture. The House Republican Reconciliation Plan would cut SNAP by roughly 30%. To put that in perspective, this cut is about twice the size of the deep cuts made to food assistance back in 1996. We're talking about taking food assistance away from millions of low-income families at a time when many households are already struggling with high food costs. So how exactly would they accomplish these massive cuts? There are four main ways this bill attacks food assistance. First, they're fundamentally changing how SNAP is funded. For nearly 50 years, the federal government has fully paid for SNAP food benefits, while states handle administration. This bill would force states to pay between 5 and 25% of food benefit costs starting in 2028. Every single state would be hit with new costs they can't afford. Here's how the payment system would work. States with error rates between 6 and 8% would owe 15% of food benefit costs. States with error rates between 8 and 10% would owe 20%. And states with error rates exceeding 10% would owe 25% of costs. Only states with error rates below 6% would pay the minimum 5%. But here's the catch: over the last 2 decades, every state except South Dakota has had an error rate exceeding 6% for at least 1 year. This means virtually every state is at risk of being forced to pay at least 15% of food benefits. Let's talk real numbers. If every state had to pay just 5% of food benefit costs last year, they would collectively need to come up with about $4.7 billion. In Pennsylvania alone, 5% of food benefit costs in 2028 would be about $212 million. That's roughly 1.5 times what the state spent on its Attorney General's office. But if Pennsylvania's error rate pushes them to the 15% bracket, their required payment would triple to $636 million. States are required to balance their budgets every year, so taking on these additional costs would force them to either raise taxes, cut funding for other public services like education and healthcare, or reduce SNAP benefits. Some states might even opt out of having a SNAP program entirely. The second major attack comes through expanding SNAP harsh work requirements. Currently, adults aged 18 through 54 without children can only receive food benefits for 3 months in a 3-year period unless they work 20 hours per week or qualify for an exemption. This bill would drastically expand who's subject to this 3-month time limit. For the first time, it would apply to adults aged 55 to 64 and adults living with children aged 7 or older. The Congressional Budget Office estimates this would cut 3.2 million adults off SNAP in a typical month, including 1 million older adults and 800,000 parents of school-aged children. But the damage doesn't stop there. When these adults are cut off, their entire households receive reduced food benefits. For example, if a mother with a second grader loses SNAP, her family's benefit would fall from a maximum of $536 per month to just $292. That's nowhere near enough to feed 2 people. The bill also makes it much harder for states to request temporary waivers of the time limit in areas with high unemployment. Currently, states can get waivers for areas struggling economically, but this bill would only allow waivers in counties with unemployment rates over 10%. Based on current data, only 10 counties in the entire country would qualify for a waiver. The third way this bill cuts food assistance is by targeting immigrants. It would end SNAP for hundreds of thousands of currently eligible immigrants, restricting benefits only to U.S. citizens, lawful permanent residents, certain Cuban entrants, and citizens from countries with compacts of free association. The people who would lose benefits are primarily refugees and individuals who have been granted asylum, people who have fled persecution and violence and have been heavily vetted by the U.S. government. Others losing assistance include immigrants who are victims of domestic violence and survivors of human trafficking. The Congressional Budget Office estimates this would take food assistance away from between 120,000 and 250,000 people, including roughly 50,000 children. The fourth category includes several smaller but still significant cuts. The bill would freeze the cost of the Thrifty Food Plan outside of inflation adjustments, cutting future SNAP benefits for all participants by roughly $7 per person per month initially, rising to $15 by the end of the decade. It would also cut food benefits for households with utility costs and end the SNAP nutrition education program entirely. Let me be clear about what these cuts mean for children. More than 2 million children live in households that would lose at least some SNAP benefits under this plan. Research consistently shows that even short periods of food insecurity harm children's health and cognitive development. Every dollar invested in SNAP for children returns $62 in value over the long term. The timing of these cuts is particularly concerning. Even as the risk of recession remains elevated, this bill would substantially weaken SNAP's ability to respond to economic downturns. SNAP doesn't just feed families, it stimulates the economy during tough times. When people spend SNAP benefits at grocery stores, that money circulates through the entire economy. It's worth noting that most SNAP participants who can work already do work. Among households that received SNAP in 2023, and included a non-disabled, working-age adult without young children, 83% had earnings that year. Many SNAP participants work in unstable, low-paid jobs with unpredictable hours and no benefits like paid sick leave. The volatility of these jobs means workers are frequently unemployed and may struggle to consistently document 20 hours per week of work. The human cost of these cuts cannot be overstated. Prior to SNAP, childhood hunger was common in America. This program has been one of our most effective tools for fighting hunger and poverty. The proposed cuts would walk away from a 50-year bipartisan commitment to ensuring that low-income children, adults, and seniors get the help they need, regardless of where they live. These cuts are being used to help pay for trillions in tax cuts that are heavily skewed toward wealthy Americans. So we're literally taking food from hungry children and families to give tax breaks to those who need them least. The bill has passed the House, but it still needs to pass the Senate. This is where public pressure and advocacy can make a real difference. Contact your senators and let them know how you feel about these proposed cuts. Share this information with your friends and family. The more people understand what's at stake, the better chance we have of protecting this vital safety net. This isn't a partisan issue, it's a human issue. Hunger doesn't care about political affiliation. Children don't choose to be born into poverty. And in the wealthiest nation in human history, no one should go hungry because politicians want to score political points or pay for tax cuts for the wealthy. The choice before us is clear. We can either maintain our commitment to ensuring every American has access to basic nutrition, or we can allow the largest cut to food assistance in our nation's history to become reality. The decision lies with the Senate, but the pressure comes from all of us. What happens next depends on whether we're willing to stand up and fight for the most vulnerable members of our society. The stakes couldn't be higher. Millions of families are counting on us to get this right.